Fuse is a public health research centre of excellence. It's one of 5 centres that have been funded nationally by the UK Clinical Research Consortium. I'm Martin White. I'm Professor of Public Health at Newcastle University and I'm Director of Fuse. Fuse is a collaboration between the 5 universities in the North East. It brings together public health researchers in those institutions, both to do research and to build capacity to do research in the future. And capacity building is one of the main missions of the UK CRC initiative.
Well, I'm Janet Smith. I'm Professor of Public Health at Teesside and also one of the Associate Directors of Fuse. I felt very strongly that it was a very important sort of investment for Teesside to make and a very great opportunity to build capacity around public health at the south end of the patch, if you like, and to build people's careers, younger researchers' careers in a way that we couldn't have done without Fuse.
I'm Greg Rubin. I'm a Professor of General Practice and Primary Care at Durham University. Well, I was a co-applicant on the original application. I'm now tutor for postgraduate students, and as a result I'm on the Centre Management Group. But it's about making sure that that Fuse is responsive to their needs and that their experience as PhD students is a good experience.
I'm Stephanie ONeill and I'm a postdoc researcher at Newcastle University, and I've just completed a PhD with Fuse, and my work explores young people's use of alcohol in the North East with a particular focus on those under the legal drinking age and the impact of price and marketing. Fuse gave me the opportunity to pursue a PhD, and has also allowed me the opportunity to expand my training. My background is sociology, so public health was quite new to me, so it gave quite a few opportunities to develop the methods I was using, meet people who might have expertise in those methods, and sort of really develop my PhD research into what I wanted it to be.
I'm Amy ODonnell, and I'm a researcher within the alcohol research team at the Institute of Health and Society, and I'm also writing up my PhD. I think for me what attracts me about Fuse PhD and working within Fuse as a kind of a virtual research team, I come very much more from a practitioner-focused research background, and I really like the fact that you link into both the kind of policy agendas and practitioners. You're not kind of working in the sort of isolated ivory tower model that sometimes academic research can find themselves in.
I'm Jonathan ODonnell. I'm a senior lecturer in public health at the University of Sunderland. I think Fuse has already developed a great deal. I think we've seen greater links between academics and policy practice and practice partners. And I think that's something that's going to expand over the next 5 years and hopefully continue beyond that.
I think it's an opportunity to shape the public health agenda. It's an opportunity to build capacity and an opportunity to change the way we think about doing public health research. So it is that chance to focus on interaction with policy and practice partners.
Our concept from the outset was that Fuse, the academics within Fuse would work very closely with policy and practice in everything that we do. So we have people from policy and practice on our strategy board and on our management group. We also ensure that we have people from policy and practice working with us on our research projects, both at doctoral level and research projects that are funded by external funders. Well,
one of the key things about the type of work Fuse is doing is its engagement with service delivery partners in practice. And I think we've made a lot of progress in that in the past 5 years, but that I think will become slicker, more effective in the next 5 years. I think that the relationships between individuals and centres has matured, and I hope that would be expressed in strong outputs and research grants.
I think it's really important that we use lots of different modes of dissemination, because if we're really trying to be translational, if we're not reaching outside our own kind of academic community, we're just preaching to the converted. I really enjoy Twitter. It's a really good way of both kind of networking on a social basis with your colleagues, but also sharing information and ideas and keeping up to date with kind of latest developments in your field. And also the blog has been quite a kind of a challenging way of trying to explain the sort of the really kind of complex and abstract process that research can be to an audience, again, beyond that sort of standard academic community. And it's really tough trying to write some of these things in a way that is understandable to anybody, but it kind of makes you reflect on what research means to you and what you get out of it. And actually I think it's been quite a kind of self-affirming process, because when I write the blogs, they always tend to be quite positive, and it makes me think, actually, I really love what I do, you know, and I really want to be able to sort of promote and get it out there.
I think one of the great jobs we've got ahead of us is improving communications, and we've made an investment in that through Communications Officer Post. It's really important that we start to demonstrate what we can do and how we can work to those policy and practice partners, and it's utterly critical in the next few years because of the transition of public health functions into different bodies.
Ask Fuse is our new responsive research facility, and the idea is that we have a single point of contact through which our policy and practice partners can find out about Fuse and about the kind of research that we do, and submit questions, problems to which they can get answers.